Hey, this episode was filmed during the COVID pandemic, so for the safety of our cast, everyone is seated 6 feet apart. Also, this series is for information and entertainment purposes only. It isn't intended to be a substitute for professional medical advice, diagnosis, or treatment, so don't delay or disregard professional medical advice based on the information provided. And, as always, if this is a medical emergency, dial 911.
Welcome to Going to Health.
For people, from people.
So this one time,
Oh, I'm gonna go get some tasty waves, bro. It was a struggle for me. I recently had to make an appointment with my primary physician, and so he wanted to do it on Zoom, and it was totally different.
it's totally different.
Yeah, I mean, it was just it was a minor thing that was going on, and he was able to diagnose it, but it was still really, it was weird.
Exactly.
I want to physically go in there, and you need to like
Exactly.
poke and prod on me, man. See what really is the issue.
That's what we want. That's
Yeah.
what we're used to.
Yeah.
You know, so it's so difficult for so many people because we don't have that.
Yeah.
You know, and some people love it. This way they don't have to go in, see their
Right,
doctor,
yeah.
they could just talk to them, but I don't know, that's not how I was raised. It's so
No, I'm with you. I like the whole physical thing. Going back to with kids and the fact that suicidal rates and whatnot are going up, and you're seeing it because of social media. And I firsthand have seen that with my kids. They're on that phone, and that's how they communicate. Especially my youngest. And recently, what I've done is I've actually put and it took me till he was 15 years old. To now have that phone say, okay, at this time, that's it.
right.
Cutting it off, no more PS4, no more TV, and guess what? We're gonna play dominoes and we're gonna play rummy.
Right.
And that's kind of what we're doing now.
So I want to kind of just like take it back to a little bit more about like you and your schooling you have to go to and the science behind the profession.
Yeah, so I was a biologist before I was a chiropractor, so I had a lot of the science background. So I was always easy for me to understand healing and the physiology of cell healing. And what was so new is like all these different unusual or not out of norm techniques that later on through chiropractic, you learn, for example, applied kinesiology is a technique that uses muscle testing as a reflex, kind of a biofeedback from the body. And that's one of the primary tools that I use to work on stress, or do this amazing technique that is called NET, which is neuroemotional technique. So chiropractors, we are stress doctors because we are removing stress from the system. And if it is through a misaligned spine, which will cause stress on your spinal cord, or if you are tweaking your diet, which is causing stress in your visceral system, or if there is an emotional stress that is manifesting physically, for lack of a better word. So the stress actually stuck. We say the issues are on the tissues, right? So the stress actually, there's little molecules of stress. It's the physiological base, and that gets impact the function of your body.
I have a question for Carlos. Because you've got these 3 kids and they're working at home, they're on their computers. What do you do to get them to exercise? Has that been a challenge for you?
Well, 2 of the 3 are out of the house.
Oh, okay.
Yeah, so
So
they're on their own. They're doing their own thing.
So your stress level is going
Yes, my
down.
stress level is going down. I do struggle with the youngest, so I kind of have to sometimes nudge him to partake in my physical activities. But once he's out there, he's out there. I mean, like I said, we'll go out, surf, go hike. He's not like how my middle son was, who was just very active. And he was always dragging me out, and I was like, I'm tired, man. Time out. I want to go home. So that's kind of the way I have to operate with this guy.
I think a lot of people have that challenge now. My husband and I do a lot of hiking, but when we go hiking now, we see people with their kids. And the parents are trying to make it like they're having a great time, and the kids are behind them just trudging along, miserable.
Yeah.
Our brains have amazing ability to adapt, okay? So if we practice, if we get those kids doing something, it will take some time, but you gotta really push, like domino, at least it's something that is more mental and, keep opening, expanding, stressing the
Absolutely.
brain so it can develop and grow.
Absolutely.
So everything, I would say, it's a matter of getting new habits, maybe push him a little bit until he gets used to this new pattern.
Right. My mother-in-law is 106 years old. She walks a mile a day. It's incredible.
That's wonderful.
Right? I mean, that's what keeps her going. She gets out, she gets vitamin D. Up until her mid-90s, she was jumping rope.
That's
So she's stress free.
She's stressed, and yet she always finds
She's found a
ways.
way to really
Shut
broaden
down,
her
yes,
capacity.
yes,
to
exactly.
Paid her
manage
dues.
stress.
Exactly. But yeah, she's always
Wow.
worried about something, but she just goes for a walk, and it really helps her.
Well, I think that's kind of our lesson for today is how to increase our capacity.
exactly
Really.
the ability of her to handle the stress and being able to manage it. That's actually one of the big predictors of a long life. And
Right. She says she's been through everything.
yeah.
She said now all she needs to see is
Yeah.
space aliens, and then she's good because she's been through everything.
That are the zombies.
Exactly. It's true. I'd like to continue the conversation that we had before about anxiety and stress. A lot of us don't really understand the difference between anxiety and stress.
Well, like we talked about, the stress is a physiological or psychological effect or response involuntary to a stressor, right? When it's a new stress, something not too permanent, we have a physiological response of increased perspiration, you can have rapid heartbeat, the breathing, which is actually very similar to symptoms of anxiety. Is the sense of overwhelming, fear, worrying about the future, and the symptoms would be very similar physiologically. You would have the sweaty palms and the heart and not being able to sleep at night. So it is characterized by increased adrenaline
Right.
too during anxiety. Correlates with this initial phase of stress. If stress continues ongoing,
Yes.
then the body gets into a chronic stage of stress. And then actually symptoms start being a little bit different. So your body is actually starting to shut down, the pattern of hormones will change, and then you actually get more susceptible to being sick or gain weight. And those are more characteristics of a chronic stress pattern. Things to focus on, the self-compassion and mindfulness and being grateful. So that's kind of
Exactly.
when it first starts. Yeah.
I think that's really important to be grateful, and regardless of what you're doing, it's very stressful for what you do. I mean, how do you handle stress?
Well, when I get stressed, I go outside and do something fun. I'll go surfing, I'll jump in the ocean, and then I'll
Right.
definitely go get some good food afterwards.
Exactly. So food really helps people a lot, and I know that's not a good tool.
Well,
to
depending on the
use.
food you
Right,
eat and how much you
right.
eat, and it's food is important. It's
Right.
fuel.
How do you handle stress?
Very similar to Haley. Anytime when I do get stressed, I work out. I do love going to the gym. It just truly provides me a calmness. I'm not a big runner, but I've actually started to run on the beach. The ocean, I'm an Aquarian.
Right.
And so that just complete stress relief for me on that end. I wanted to go back to the anxiety piece because this is the thing. I'm a first generation Mexican American. And my family came from Mexico, and it was like you had to be mentally strong. How does your practice handle or work with those folks with anxiety?
Yeah, I see patients that are under medication,
Yeah.
prescribed by their psychiatrist. I'm definitely not taking my patients out of the medication. It's not on my scope and not on my, I'm not licensed to do that. Taking the medication is not going to change the practice, changing the habits.
Right.
So eventually my hope is if we get them to do those practices of the meditation, of finding a physical activity, getting a dog, touching my dog, being present time awareness, just feeling that fur and just being, it's just amazing to me. It just completely melts me. And it's just a matter, of working on it and creating those habits.